Hello and welcome to Behavioral Health and Social Justice, an interdisciplinary approach to policing and social work. My name is Dr. Carolyn Sutherby. I am an assistant professor in the Department of Social Work and very disappointed that I couldn't be attending in person today. Due to COVID, I am at home, but my colleague and co-creator of this course, Dr. Walters, is in attendance in person. So she and I will be discussing this topic with you all today. So we'll run through our agenda briefly. We'll be discussing today, this course is experimental, and we want to spend a bit of time kind of unpacking the purpose and the reasoning why we brought this course to Ferris and some of our intentions around that. We'll spend a bit of time talking about how we developed the course using both empirical research and anecdotal information. Spend time unpacking the theoretical foundation, which is interdisciplinary collaboration. We'll talk about how we intended to implement the course and our intentions for the future to continue to offer this course at Ferris. Also discuss the research that we'll be working on involving this course, some of the outcomes that we'll be measuring. And finally, we're hoping to have some discussion and any questions that you may have that we can answer. So why a course on behavioral health and social justice and the connection between policing and social work? Dr. Rita Walters and I were in a staff meeting together along with some other colleagues, and the issue of the national conversations that were occurring around police violence towards people with mental illness came up. And in a chat conversation, I kind of mentioned this is an area that I was very interested in, and she wasn't as well. And so we agreed to meet and kind of talk about our passion around these areas, but then also if and how there may be some ability to bring some of this attention to Ferris State University. The conversations at the time that were occurring specifically around police violence intersected with certainly Black Lives Matter and other systemic issues around criminal legal reform. We wanted to focus specifically on certain areas within social work and policing that also intersected with this area. We also discussed there has been an increase in social work involvement as first responders to behavioral health crises. So social work as a profession has a long history involved in the criminal legal system in both youth and adult fields. So social workers go into parole and probation. They are correctional officers. They work within jails and prisons. They've had a long history of administrative work and policy in this area, as well as working on diversion programs and alternatives to incarceration. So this is not new. What's been developing more recently over the years is direct involvement with a partnership between first responder law enforcement and social workers. So hiring practices have occurred where social workers are being employed within police departments. We'll spend a bit more time talking about that. But we recognized there was this increase, and we really wanted to be proactive and get in front of this at a university level to offer our students information about this, knowing that there is a demand for this type of work, which we'll talk about a little bit more later. And then lastly, we looked at this as an educational general ed course, and it's focusing specifically on behavioral health and social justice concepts within law enforcement and social work. So behavioral health, to put into context, is a broad term, and under the umbrella of behavioral health are mental illness, substance use disorders. It also covers cognitive and developmental delays, neurodiversity. There's also some medical and health principles that are incorporated underneath that broader concept of behavioral health. This course is specifically looking at mental illness and substance use disorder and/or addiction, but you can't get away from other aspects of behavioral health because it's not in a vacuum. So all of those kind of elements will come into play. But when we're using the term behavioral health, that's what we're speaking to. So by critically analyzing the ideological differences and similarities of how these professions view specifically safety, cultural competency, and behavioral health, our hope is that students will learn ways to strengthen the social work and law enforcement collaborations. The course designed is not to bash police or law enforcement. Dr. Walters and I recognize systematically there are issues with police departments and criminal legal system. There's also concerns and issues with social work profession. So we're not isolated in this regard. There are similarities in how we view areas within mental illness and substance use disorder, but there are also differences. And our hope was to have some dialogue and open communication about these areas, knowing that there is demand for partnerships with social work and criminal legal system professionals moving forward. We really want to be intentional about having these conversations at a university level. Ferris is known for creating these programs and preparing students for employment when they leave. And so we recognize that this issue is at a local level, but also nationally. And we really wanted to be at the forefront and be innovative, which is why we're here talking about this. So the objectives for the course, part of this, when we talk about behavioral health and specifically mental illness and substance use disorder, we could not get away from this idea that we wanted to educate students about behavioral health. And the student body as a gen ed class was offered to not just criminal justice students or those on a social work track, but it's gen ed, so it's open to any discipline. So the mental health first aid program is a nationally evidence-based program that teaches people how the skills and how to respond to mental health crises, and also by seeing the signs of mental illness and substance use disorder. So folks in this class would receive a certification in mental health first aid. The certification is used broadly, but in this case, it's similar to, some of you may have heard of psychological first aid. There's a few other specific programs designed for law enforcement in learning about behavioral health aspects. Mental health first aid also does have a track specific actually to higher education and also criminal legal systems. But this idea was because we're offering this course to a broad student body. We wanted inclusive to everyone. So students in this class would be receiving the certificate so that when they leave the course, regardless if they go on to a position within social work or the criminal legal system, they'll have a really great sound foundation on recognizing signs and symptoms and being able to appropriately respond to those. We also want our students to recognize the behavioral health needs of people in the criminal legal system. There is a lot of research that is demonstrating folks with serious mental illness and substance use disorders, addictions are making up a large body of who we see involved in the criminal legal system. So we want our students to be able to recognize, first of all, what mental illness is, what substance use disorder is, and then how this intersects with the folks that we see within the criminal legal system. We also want to be intentional to help our students understand the complexities of law enforcement officers in their response to behavioral health crises. So as I said in the beginning, the idea isn't to bash police officers. We recognize the system that they're working in. We understand that resources are not where they could be. We know that police officers are responding to calls that involve people in direct psychosis. And maybe these specific law officers haven't had adequate training to work with these folks. They also don't always have And many times they don't have places to take these clients. So even if they've had some training and they feel confident in their ability to recognize signs and symptoms, they may then only be able to take someone to an emergency department or incarcerate them in jail. So we're looking at broadly having conversations around this specific area, recognizing that it's not a perfect system by any means, and our law enforcement officers are charged with answering calls that social workers have been responding to since the infancy of our program and our profession. So we also, in hearing about the keynote speakers today, and something that struck me was this idea of taking a risk when you're an innovator. And I can personally say it is a bit of a risk to invite this kind of conversation and course into Ferris when we have a CJ program and an academy that is very well known, very reputable, and we have a social work program. And we have sort of historically, I am new to Ferris, so I'll say that now, but in talking to staff in both departments, there's been some siloing and a bit of tension between these disciplines. And that's across the board. In the conversations I've had with law enforcement officers throughout the years and in my work at the Center for Behavioral Health and Justice at Wayne State, we found that to be pretty common. And so we understand that we don't agree on how to operate within each other's systems, and we may have disagreements about that, but we have more in common than we don't. And at the end of the day, this is a great opportunity to have these tough conversations, knowing that where we are in this space is not, it's not going away, there's sort of this pendulum that can swing in both social work and the criminal legal system in kind of these combinations and collaborations. And all of the data that we have is demonstrating that this is not going away. And so it's important that I think at Ferris and in broader terms that we have these tough conversations within the disciplines so that we can move forward. And lastly, we really want students to appreciate the value of police social work partnerships. So I can speak for myself personally in this work that I've been doing in this space that there are many social workers who do not advocate for social workers being involved with police. Just like there are police officers that feel the same way and police officers that are really excited and interested in this kind of partnership. So we want to be able to talk about all of that, and the data demonstrates that this can be a very productive and efficient partnership for clients individually, for systems, and we want to be able to have dialogue around both the similarities and the differences in these ideologies. So in terms of the interdisciplinary collaboration and the theoretical foundation, I will pass it over to my colleague, Dr. Walters.
Thank you. And welcome. I just want to share with you that we have agreed that we'll be a little less formal, a little bit more intimate. We're small in numbers, so I hope you'll join in on that and appreciate that. Thank you. Thank you. Safety is paramount. However, please feel comfortable. As Dr. Sutherby shared, what was really at the core, true essence of this course design is promoting professional development. And we really want to provide our students with skills where they go into the profession of social work or criminal justice, really understanding what is identifiable with indicators of mental health, what are some of the responses that would be appropriate and suitable based on that level of understanding, and then how do they identify the resources to connect that particular individual to get those services that they need to address whatever it is the presenting concern. So professional development being, again, the core of our focus, we thought it was important to look at a framework that focused more on collaboration and not about changing the structure of the systems that are available to provide that education to our students. So it wasn't about what are we doing differently in our program, what changes need to occur within the criminal justice curriculum, what do we need to, how can we enhance it? But giving more of a focus to what can we do in working together to provide that or promote that level of professional development that will help our students be best prepared to work in their profession. So on this particular slide, I'm just going to share with you a few different definitions of what interdisciplinary collaboration is. It is the inquiries which critically draw upon two or more disciplines, lead to an integration of disciplinary insights. So it's really giving value to appreciating the distinct attributes within those disciplines, but also understanding how can you move those two together or bring them forward and bring them together and move forward in addressing whatever may be the goal of that discipline. It is learning experiences. They should be experiences should theoretically have students apply and integrate their interdisciplinary knowledge to solve real world problems. So we really appreciate that particular definition because it brings into addressing some of these very real concerns that we're seeing in the world today. Dr. Sutherby mentioned police brutality, these national conversations on some of the national cases that we've heard over the decades. And this is not unique to the last 2 or 3 years, but there's been decades and decades of case examples where there's been emphasis on what needs to happen within the system designed to create a change. We've brought that definition forward to help us in designing this course to appreciate, well, we have to give attention to these real world conversations and these real world issues. The last definition here from Bruner is that interdisciplinary collaboration is an effective interpersonal process. So that's bringing in what we refer to in the field of social work, use of staff, right? Now we have to understand who we are as being a part of this changing process. That facilitates the achievement of goals that cannot be reached when individuals act. So, wow. What is Bruner telling us? The definition is saying that we want to solve world problems, but we also got to appreciate we can't do it alone. We cannot operate in these silos and be effective. So taking these 3 definitions, we started to build on our theoretical foundation that helps us to identify what would be the critical components and the content within our curriculum or our course design. So this model of collaboration, where disciplines are working towards a goal, best practices in responding to these issues. Our best practices in social work should complement, if not necessarily mirror, the best practices in law enforcement and in the realm of meeting the needs of individuals with mental health challenges. So it's not a competition, and it certainly is not taking away the spirit of giving or devaluing the attributes and the specialized special care that can be provided within different disciplines. But it's looking at how do you bring those two together through some sense of collaboration to address those needs. There's an emphasis on cultural and social factors. So we know that social work has an identity, and we know that police law enforcement has an identity. And so what are those social factors that are influencing the way they operate as a profession? So being mindful of that was important. Define outcomes. We're working to achieve the same thing. We want to increase safety, right? We want to ensure not only the person who is presenting with the mental health challenges is safe, but also those first responders are safe. We want to reduce judgmental error. Now, we can spend a whole hour just talking about what that looks like in theory and in real time. The reality is we are very judgmental professionals, right? It is our judgment that helps determine what is the best course of action to take, right? We do our analysis of the situation, we bring forward our competence, our understanding about that situation, and then we have to kind of make a call. What do we do, right? And we have a whole set of tools in these toolkits that help us make that determination. But there's some judgment that goes along with that. So we do want to minimize and reduce error in that regard. We certainly want to give attention as well in developing this model. We want to give attention to how we sustain over a period of time. What can we do in using this as a foundation that will sustain us? Not be kind of that individual case response, but what would be an ongoing. So again, this created for us a sense of what would be an appropriate foundation to use in our course development. We wanted to give attention to Bronstein's model, which includes 5 core components, interdependence, and that notion of obviously speaks to the collaboration, giving attention and appreciation to those individual values and attributes within those disciplines. Newly created professional activities. I think that resonates a lot with what was shared this morning in the opening with the speaker this morning. Gosh, I can't believe I can't remember his last name. Philosophy?
Steve. I know it's Steve.
Okay. I didn't want to use first name, it's only on a first name basis, but but to speak about innovation, right? And having some creative, some space for creative energy is important. So these newly created activities can be part of that innovation. Being flexible enough to say, what is working well within your discipline? What approaches are you taking that we could possibly adopt? But also being flexible to say, you know what, maybe this area is not an area that would be my forte. So for example, if we're looking at environmental safety, that may be deferred back to law enforcement, right? Because there's more investment in your training and building your competence to think about environmental safety. Where in our profession, maybe that is not as paramount. Collective ownership of goals. Again, there's a strong component for collaboration when we appreciate that hopefully we're working towards the same goal, but the path we take may be a little different. Okay? But the process of getting there with the investment within each of those disciplines is going to be critical. And then having time to think about that process. What did we do well? What we'd like to have done differently? And it's not about a right or wrong, but it is really having to enhance or make better that process as we continue to achieve that sustainability. So I want to hear from y'all. Could you just share if you've been part of any collaborative efforts, maybe with the different disciplines, or for example, with law enforcement corrections, what has those collaborative efforts looked like for you? So if you're comfortable and willing to share a little bit about your experiences, I want to allow you to do so now.
I'm Steve Hunter-Smark, and I'm late. Sorry about that. I think I was a part of this, but law enforcement, I'm retired. We haven't been collaborative, but I think that there's room, obviously, to do it. As a matter of fact, like policing, it's problem-oriented policing. It involves routine cross lines, working with social work and such, and focusing on problems. You guys talked about silos and problems. We have been in our silos when it comes to mental health response and such. I think that we don't need to throw the police out. We don't need to throw social work out either. But what we do need to do is do the problem justice and bring them together to work on problems. And I think that that's probably should be the future for policing, is to start working on problems. Actually not for policing, but for solving problems that occur in law enforcement and occur in social work. We find that common response work together to solve the problem or to diminish the problem. So part of the problem is, you're right, is that law enforcement has always been very isolated, and we've never really focused on trying to work on the problem in a better way. We've just always responded, tried to fix the problem as quickly as possible. I can remember way back in my day arresting people, just for the sake of getting away from family or whatever, to try to solve the problem. That's not solving the problem. It's a quick fix. It doesn't work. So I really think in the future of all this movement is policing and such as that we learn and we start to work with you guys and other people. And focus on problems, big problems like mental health. Since when I was a police officer in '81, it's been a problem. And continued when I walked up the door to this day.
Thank you. Anyone else care to share any collaborative experiences?
My name is Kate O'Connor, and I'm an architect. So I'm in the School of Architecture and Facility Management, and I'm incredibly attracted to this presentation. And I'm late also. I didn't realize that there was a room around the corner here, so it was kind of canvassing the hall, stalking. But one of the things that I've realized throughout my years is that architects have been siloed themselves and are expected to solve design problems based on the knowledge of their own competencies. And I think that that's so myopic and just so egotistic. And so, especially moving forward where needs have to be met, like with engaging communities, we start to be interdisciplinary with working together with different types of different like medical professions and social workers that are dealing with elderly populations and things of that nature, I think would be really helpful in creating more inclusive design. And the other thing is that my research is socially responsible design. So I actually design for individuals or communities who don't necessarily have a voice. So working collaboratively with communities has been very helpful. And so I know the works of Jerome Bruner as well. He's one of my favorites. And so to hear about, I didn't even realize about interdisciplinary. So I've been taking pictures of your slides. I hope you don't mind. But I think it's so essential moving forward, and just to hear the results. I'm looking forward to that. So, and there's great experiences and there's terrible experiences. And it's when people's egos get in the way and when people think they can do everything and that they're right. So it's been an interesting journey and still on that journey. So,
yeah, and I think our speaker this morning gave us kind of some reassurance that the thumbs down, those negative experiences are opportunities for growth, right? And that the failures can lead to kind of the fruit of the labor, if you will. So thank you. And I appreciate you sharing, because I love the idea that this is applicable in other disciplines. So, this conversation is about social work and law enforcement, but definitely can be, again, appreciated and possibly adapted with other disciplines.
And this is my first year at Ferris. I came from another institution in Northeast Pennsylvania. I was there for 10 years. And Carolyn, I think you presented to our little intro group at the beginning of the semester. So, and she spoke about the opportunities for the innovative opportunities here at Ferris. So I was also excited because I was kind of crushing on what you were doing in the past, like by being introduced there. So I'm excited.
Well, welcome to the Ferris.
Thank you.
So what we want to share in this next film or next slide is a short, I think it's maybe 7 minutes of a short TED Talk, and we'll try to be cognizant of the time. And I hopefully.
You think we have time? You want me to show it, Rita?
I was going to say, can we show maybe the first 3 minutes of it where Derek explains what the collaboration looked for? So Officer Derek Jackson is the Director of Community Engagement in Washington County, so further south of us in our area. And his office is in Ypsilanti. What he did, he's an MSW, has a social work degree, but also a police officer. And he has a vision of building better, stronger relationships with folks in the community by understanding some of their social issues that were impacting or not influencing, but lending themselves to some of the criminal activity that was going on in the community. And so in this short TED Talk, give kind of a quick overview of what they were able to do, the innovative steps and efforts that were taken in Washington County Sheriff's Department to really model what we want to accomplish through our program. Carolyn, is your video, could you make sure you click share sound on your computer, because we can't hear the sound?
Maybe.
Oh, go back to share screen.
Yeah, on your share screen.
And then at the bottom, it'll say sound.
share.
Sorry, I don't mean to be bossy.
No, please. This is collaborative.
Exactly. So you're gonna model that for us right here and now.
Oh, that's great. Thank you so much for that.
Sure.
When you look at the badge, what do you see? Do you see honesty and integrity, or do you see brutality and disdain? And regardless of how you answer that question, whether you're an officer or a resident, the idea that I plan to share with you tonight hopefully gives you a different perspective of what's possible through law enforcement. You see, I'm a social worker that runs a police agency. I'm the director at the sheriff's office, and oftentimes when I say that, I get a strange look and people say, well, how'd that happen? And really what I get to do is connect those two every day, to create change within individuals, but also change within various neighborhoods within our community. I mean, think about it. As a young social worker, I started out working at Ozone House, working with homeless teenagers. It was not uncommon at all for an officer to find a runaway or pick up a homeless kid off the street, knock on our door and bring them and connect them to services. Or what about the mom who's just been abused and we respond to the domestic violence call? We arrive to find her battered and bruised. And it's not uncommon for us to be the connection to Safe House. Or even the call we get about someone who's loitering downtown. We arrive and find out that that man is homeless. It's frigid outside in the winter, and we sometimes are the first connection to the shelter. So imagine if we use that connection to not only focus on arresting people and solving crimes, but if we also used it to focus on understanding the problem and addressing the root causes. I think there's a fundamental problem with only focusing on crime, and that is that a crime has to have been committed, someone has to have been victimized before I take action. Why not understand the root cause of that crime and hopefully prevent it from ever happening again? And so I give you an example. In one of our downtown areas, we had a huge problem with prostitution. We'd get business owners and family members complaining. We'd put a sting together. We'd make some arrests, focus on the crime. We'd push that problem to the city. The city would get the same complaints. They'd make some arrests. They'd put a sting together, and they'd push it right back to us. Never focusing on the problem, but always focusing on the crime, we pushed it back and forth between one another. Until one day, one officer, she's undercover as a prostitute for one of our stings. She's trained, she has backup, she has her gun, and yet she's fearful. And she asked herself the question, what would make a woman do this? And in asking that one simple question, she went from focusing on arresting someone to trying to understand the actual problem. And so she began to ask the women, where you come from? Why are you here? What do you do? Why do you do what you do? And over the years, what we found is every single one of them was an addict. And us simply arresting them and putting them in jail had nothing to do with solving the real problem. And so this officer, yes, we still do stings to this day, but before anyone ever set foot in the jail, those women go into a room with a group of social workers where they get an assessment. That assessment is turned into a bond recommendation that goes to the judge. The judge uses that to sentence the women. And while they're in jail, they're actually getting services. That is the difference when you focus on addressing root cause problems versus just on arresting people. One officer, one question, changed the way we deal with prostitution and addiction in our community. Now, when those women get out of jail, they have an opportunity and a choice. They can go back to the neighborhood and do what they were doing before. They're free. Or they can go to the Home of New Vision, which has beds set aside just for the women coming out of our program to focus on and deal with addiction. I'll give you another example, heroin. Heroin in Washtenaw County, just like in many places around the country, has ravaged our community. We as community members became aware of the heroin problem 2 summers ago when we had 12 overdoses in one weekend, 12 ODs in one weekend. Do you know when officers knew we had a problem? Over 4 years ago. So imagine if officers, instead of only focused on arresting people, for having heroin or using heroin if they were also asking the question of why are we seeing so much heroin in our community? And maybe, just maybe, we in the community could have wrapped ourselves around that problem before it ever became an epidemic. It's also said that in Washington County, we have one of the highest rates of recidivism in the state of Michigan, meaning someone commits a crime, we arrest them, we put them in jail. They get out, they reoffend, we rearrest, we put them back in jail. The cycle goes on and on and on. Now, some would say it's because officers in Washington County do such a great job at solving crime and putting people in jail, but we would actually say why. How is it possible for someone to come into our jail 11 times? Not prison, but jail. If you've been in our jail 11 times, you're not a violent offender, or you would have already been gone to prison. So why are you here? Is it because you have mental health challenges, or you struggle with substance abuse, or you're homeless, or you struggle around educational issues, or maybe it's employment? And so one way that we actually decided to deal with this was to hire people coming out of jail and prison to work at the sheriff's office. Yes, we hire felons at the Washington County Sheriff's Office. I can't believe it myself sometimes. But we don't hire them to sweep our floors. We don't hire them to be informants to work with detectives. We hire them to be the experts on the communities that they come from, to be street outreach workers, to use their trust, their street credibility, and their relationships to help build up the neighborhoods that they once tore down.
Carolyn, you
And
want
so
to
there's
pause
Julia,
there?
who at 64 years old.
And hopefully you can go to that site and hear more of Officer Jackson. He does offer a couple more examples of bringing in folks from the community to help the police better understand problems of the community, understand what the specific needs are and how they can be part of that resource system of resources to address those needs in the community. So Carolyn, I believe the next slide takes us right into how we develop the course, what is in the content of the course. So I'll let you share that.
Thank you. So in terms of content for this course, this is first of its kind at Ferris, and currently there are no other known courses like this at other local universities. I mentioned that at Michigan State, they have a certificate program in policy, law, and social work. At Center for Behavioral Health and Justice at Wayne State, where I was previously to Ferris, they're working on a similar kind of program where it's more policy oriented. But we really wanted to kind of get in the forefront, as I said, and kind of be proactive about this course here at Ferris. There's such a great reputation with the academy here. And again, like I said, with social work, it seems like a great marriage of both of our disciplines to move forward. We also know that this partnership between social workers being employed at law enforcement is occurring locally. So Lansing has a social worker, Livonia, as Derek mentioned in his video, he's working with social workers in Washtenaw County. Grand Rapids, where I live, Grand Rapids and Kent County are both looking at this kind of model. Detroit is looking at it. Nationally, there's in Seattle, in Memphis, I mean, I could go on. There are partnerships occurring right now. And so the idea that this is sort of just, another a new idea that gets a lot of momentum and then kind of fizzles out, the data does not support that. What the data is showing is that this is not going away. And we in part of this content really wanted to offer students some experiential learning opportunities. So Dr. Hunter Smart, who is here with us today, and I'm so disappointed I didn't get to see you, is someone that we're going to partner with on this course, as well as Dr. Ferradino from the CJ department here at Ferris. We also have a Kent County 911 dispatch supervisor. So this is someone who actually works in a private practice where I work at, and she works specifically with law enforcement officers and first responders, so fire, paramedic, and EMS, providing therapy specifically around PTSD. And she also has a really interesting perspective on, as a social worker, working in context at that starting point. So when the calls come in, helping to discern between, is this a mental health call? Is this a substance use call? And helping prepare law enforcement when they go out to calls so that they're aware of what they're going to witness sometimes. And also speaking to the 988, which that's another discussion, but some of you may have known that there's 988, which is rolling out nationally right now, which is a behavioral health crisis line that should be used as a kind of transition from 911 calls versus 988 calls. So that will be coming out too. That'll be staffed in Kent County primarily with some social workers. So that's going to be an interesting person to get some discussion from. We also have Derek, who we talked about as a consultation and as a social worker and a police officer. The East Lansing social worker who I'd mentioned who was hired is interested in working with us as well. And then we've also spoken to a few folks with lived experience that we want to be able to incorporate into the class as well. In terms of development, we applied for and received the innovation grant in 2021. I became a mental health first aid instructor, so I went through the training in order to be able to provide the certificate for our students who take this course. Again, we talked about collaboration that we've had with CJ faculty at Ferris. That certainly can be expanded on and expounded upon. That is my hope. I would love to get more immersed in that department and learn and hear from faculty, and just like Dr. Walter said at the beginning of this, hear from their perspective and really sort of figure out how we can marry our professions in a way like Derek was talking about to move forward. And there's still some work to be done in that for sure. Mentioned our consultation with Derek at Washtenaw County. Dr. Walters and I have also been attending many developmental workshops, specifically through the Criminal Justice Clearinghouse, which is led by criminal justice staff to provide trainings for folks in the criminal legal system. So their perspective is one of law enforcement, and the theoretical underpinnings and their models that they use are one of policing and corrections. And so for me to be a part of these trainings has been really eye-opening in hearing about how much we actually do have in common of this common goal of justice. And what Dr. Walter said, we have this goal, it's just our pathways of getting there are a little bit different. So we're going to continue to do that. And then we also have a graduate assistant who has been trained in, Dr. Walters will talk a bit more about the research that we're going to do around this course. So in terms of implementation, we originally offered the course this spring in 2022. Unfortunately, we didn't have enough students enrolled, so we were not able to offer the course. So we plan, again, we have support from the university to offer it again in 2023. And so we'll have a new marketing campaign. We're working with some different folks at Ferris to get the word out. We'll plan to recruit more students and promote the course, hopefully in a different way to get a bit more enrollment. We'll continue to build partnerships and collaborations with the CJ department here at Ferris, as well as law enforcement agencies. Again, continue to attend more professional development workshops. And I'm in the process right now of facilitating mental health first aid certification workshops. We have one we're getting scheduled right now for advisors at Ferris. So hopefully I'll get that a little bit more experience in providing that, so that by the time the course comes, we'll be able to efficiently kind of navigate that into the course. So Dr. Walters, would you like to talk about the research aspect?
Sure. So one component of this, and you all know this, you have these experiences, but you want to know what you're doing with the good things, right? You want to better understand how are you achieving your anticipated outcomes. So research is critical. We are obviously developing this course with evidence-based practices. We also want to know if what we're doing, our use of STEM, is just as effective in achieving those outcomes. So the research component is critical. We have been fortunate by being awarded the grant to have money set aside to hire a graduate level student to do some data collection for us and data analysis with our supervision. So it will be kind of like a two-tier approach. One approach is to look at the process of us implementing the course, looking at our course design, what kind of measurement tools, or not just measurement tools, but teaching tools that we utilize in the course, what was their effectiveness. So there'll be some assessment based on our own experiences. And then the second component will be getting data from the students. So how did they achieve those course objectives, learning outcomes that were anticipated? With that data, what we hope to be able to do is justify the course, that it is achieving what we wanted to achieve. It is an asset to the university. And then hopefully we'll continue to collect data from those students that were enrolled in the course once they're in the profession working and able to share with us how they were able to utilize those skills and how was the competency gained from the course beneficial in their various roles. So we obviously give a lot of credence to research and understanding how it can help us in developing a great course. Carolyn, was there another slide or were we almost at the end of our presentation? Yeah, I think that was it. So we have maybe 4 minutes before you all need to transition to your next workshop. I'm certainly grateful for the time and attention you gave us, and we are flattered that you wanted to invest your time with us. Do you have questions for us? Any thoughts, comments, advice for us moving forward? We are definitely open to hear that from all of you as well.
This would be available for criminal justice students as well.
Yes, it's open to all students. Anyone at the undergraduate level can register for the course.
And mental health certificates, pretty good thing to have, pretty good draw.
It's going to be a big piece in our marketing, because definitely will give them that little edge when they're applying to positions and have that on their resume.
But you're also offering freestanding mental health first aid workshops?
Yes,
Outside the class?
Yes.
Because I think deans, advisors are great, but deans too would be very useful.
Yeah, Carolyn, you're opening up I think you're planning to do maybe 3 of them over the summer or throughout this year. And so,
Yes. Yep,
So
absolutely.
if
Yeah. I mean, part of it, I appreciate that because we were first originally going to target the students. And then in another meeting, an advisor, Dave Schrock, said, our advisors need this. And then I reached out to the counseling center just to make sure they weren't already offering it and make sure I'm not stepping on toes. And they said, no, faculty need it too. And so I'm hearing more interest in it. And so that gives me I'm excited and I'm willing to offer as many as possible. I mean, if we could, my dream would be Ferris State University, everyone from, sort of universally from our staff as faculty and students all the way through the university and have this common thread that we are all aware of these signs and can know how to respond to them efficiently and appropriately. That would be amazing.
Let's have conversations and let me know what, as your dean, I can do to assist, because I think it's a terrific idea.
I appreciate that. Thank you.
Yeah, I was actually along the exact thread. I think that there's even opportunities outside of Ferris State University where this could be so beneficial for so many communities that desperately need this across the country. And it would be wonderful to see that Ferris Forward represented in sometimes marginalized communities that suffer from this lack of resources. I think that would be so amazing.
Yeah, it'd be nice to see if that is an outcome in the partnerships with law enforcement agencies. If they allow us to kind of be embedded the way that we can provide this type of certification. Just hearing from Officer Jackson, he really has been a great resource for us. We connected with him, almost 2 years ago, right? And taking our calls, joining us in Zoom meetings. He's just been a great resource. I hate to kind of use a buzzword, but we definitely need the buy-in, right, from our partners, right? And so if this is a strong collaboration with law enforcement, our CJ department here at the university, we definitely want them to value it as much as we can. And so I think that would serve as a great opportunity.
Good luck. I think that's wonderful.
Thank you.
Thank you.
Great idea.
Well, again, appreciate your time for being here. And I don't know if we have those who are joining us via Zoom. If so, thank you. Were there any questions posted in the chat? Okay. All right. Well, enjoy the rest of the conference. It really seems to be very well organized and really great workshop. So I hope you find the rest of your day to be beneficial. So thank y'all.
Great job, Rita. Great job, Carolyn.
Thank you.
Thank you. We hope we made the college proud.
You certainly did.
Didn't paint the opinion of us.
I know. That's contrary.